Hello everybody and welcome to the Tuesday edition of Video Clips, and I will start with important announcement this week. Summer semester starts, and that means that this week the Diet and Lifestyle Intervention course starts. This is the celebrity lineup that you guys know and love: John McDougall and Neil Barnard and Caldwell Esselstyn, me, of course, and many others, excellent instructors. This is your chance to learn a lot about the science of nutrition, specific protocols, etc. Those of you who are thinking you might like to join the Wellness Farm Health Provider Network, you need to take this class. This is a good time. And some great other courses we're offering summer semester too, like nutrition and cardiovascular disease, maternal and pediatric nutrition, etc. Okay, so I've got a couple things to talk to you about today, and the first one is patients with high blood pressure are usually medicated, even though medication's not effective, particularly for patients who have blood pressure under 160/100. I mean, I think there's pretty much universal agreement that when sustained blood pressure hits 160/100, medication is warranted, but below that, not so much. And of course, one of the leading reasons for medicating is to reduce the risk of stroke, which is really, really high in hypertensive patients. But a new study clearly shows that many patients do not benefit even when the medication works. I'm using air quotes there because works means that lowering blood pressure to target levels, all right? So, and this goes to a topic I talk about a lot, which is the difference between having pretty blood work and having better health outcomes. All right, the study included 26,875 people over the age of 45 who were divided into 4 classes of systolic blood pressure. There was normal, pre-hypertension, stage 1 hypertension, stage 2 hypertension. I'm not going to read off the numbers to you. You can look at this article in the Health Freaks online library, but there were also 4 classes of medication use. Believe it or not, 1, 2, 3, or more drugs. Hard to believe we give somebody 4 or more medications for hypertension, but we actually do that. Okay, so during 6.3 years of follow-up, what happened is 823 strokes happened. 46% of those strokes involved patients who were treated successfully. Now again, the definition of successfully is that their blood pressure was lower to 140 or lower, their systolic blood pressure. Now notice that 54% of patients taking the medications, their blood pressure didn't even go down to target levels. But even worse, stroke risk increased for every additional drug added. The more medications the patients took, the higher their risk of stroke. In other words, more meds equals more illness. A patient taking 3 drugs who had systolic blood pressure lower than 120 had a higher risk of stroke than a patient with stage 1 hypertension who took no drugs, and a 250% increased risk of stroke when compared to a person with normal blood pressure. The bottom line was that half the people taking drugs didn't even reach successful lowering of blood pressure, let alone reducing the risk of stroke. The medications make people worse instead of better. Now, let's contrast with this with another study that involved men with an increased risk of stroke and the researchers looked at diet and lifestyle habits as opposed to medicating them. The study included 11,450 Swedish men with a history of hypertension, high cholesterol, diabetes, heart failure, or atrial fibrillation. Researchers looked at their lifestyle habits and then the incidence of stroke in the study population. Now, how they defined healthy lifestyle: 5 or more servings of fruit and vegetable a day and less than 30 grams of processed meat daily, being a non-smoker, more than 150 minutes a week of physical activity, and that was just walking, biking, any kind of moving around, body mass index between 18.5 and 25, and low to moderate alcohol intake. So during 9.8 years of follow-up, there were 1,062 strokes in the study population. And here's a newsflash: the more healthy habits these guys practice, the lower their risk of stroke. For the men who practiced all 5, they had a 72% reduced risk of stroke when compared to the men who only practiced 1 or none of the habits. So take a look at these 2 different research studies. One showed that no matter how much you lower the blood pressure with drugs, you don't reduce the risk of stroke, and that over half the population didn't even lower their blood pressure with the drugs. Unsuccessful. The other study showed men who have healthier habits reduced risk of stroke. Which one would you choose? We call that an informed discussion here at Wellness Farm Health. And everybody always says, why can't we get everybody to do this? I think one of the reasons is we have too many people who drank the medical Kool-Aid and they think that these drugs are helping them. When they see the reality of how ineffective they are, it's amazing how motivated people will become. All right, so another topic today. I found this really fascinating. I don't know how many of you have heard of a guy by the name of Brian Wansink. He's director of the Cornell Food and Brand Lab. He's written some great articles and a book. The book's called Mindless Eating, and I use it as a textbook. He does a lot of research on what motivates eating behaviors, and he says the average person makes about 200 food-related choices a day, and 90% of them are instinctive and don't involve conscious thought, which has to be true because I was thinking about when I read this, how many times I thought about food yesterday, and I don't think it was 200. Not that I knew about anyway. I think about food when I get hungry. It's not 200 times a day. All right, so anyway, after looking at 112 studies on healthy eating and behavior in settings like schools and restaurants and grocery stores and homes, Wansink determined that there are 3 ways in which we could make healthy eating more accessible and encourage more of it in any setting. He calls the method he developed as a result of the research the CAN approach for convenient, attractive, and normal. Now here's what convenient means. It refers to the way that food is offered to target markets. For example, Wansink asked kids between the ages of 5 and 11 why they didn't eat more apples and pears. It was interesting what they responded. They said that the fruit was too big for their mouths, and some kids said that the apples and pears got caught in their braces. Older girls said that apples and pears were messy and they were embarrassed to eat them in front of their peers. Solution: pre-cut fruit. Increased fruit intake by 70%. So you look at what's standing in the way of your target market doing better and you make changes. Wansink said that manufacturers and food sellers could make choosing healthier foods easier by helping people to visualize healthy choices like smart menu boards, personal menu profiles, visual cues where somebody could see something and it would cue them to make a good choice. Now, attractive means that better choices have to look more attractive than unhealthy foods, meaning either improving the packaging or using the price point. He says that kids are more inclined to eat dinosaur trees than broccoli, and big bad bean burritos instead of vegetable burritos. Color labels and packaging can make healthier foods more attractive, and it's not just to kids, it's to adults too. And by the way, this is how the sellers of junk foods do it. Maybe we should take a page from their playbook and incorporate it into our own. Wansink says that industry, it goes to normal, he says that industry's been really successful in the past by using packaging to change behavior. And he cites, for example, those 100-calorie packages that have, and resealable bottles that have redefined the definition of what a normal portion is. So the food manufacturers could actually be engaged in helping with this and make more of these, of healthier foods attractive. So from Wansink's perspective, healthy eating and healthier choices, it's just a marketing game. I agree, and here's my take on this. I think that those of us who work at promoting healthier habits and diets have to look at how we make our message more attractive to our target audience. Instead of focusing on how resistant people are to the message, and I hear that all the time, nobody will listen to me. How do you get people to do this? All right, I know I sound like I'm whining, but sometimes it sounds like whining to me. Let's think about how we can make the message appealing and package it up so that people respond. Let's treat marketing health and healthy eating the same way that any other product or services treated by business people. Let's focus on what the consumer wants and frame our message so that they want what we have. And I think that's so much better than continuing to do the same thing over and over again and waiting for people to smarten up. And I hear a lot about that these days too. When are people going to wake up and realize? I have news for you. Never. All right? It's our job to frame the message so that people want to buy it. And if they're not buying it, not their fault, our fault for not talking to them the right way. We're pretty busy here at Wellness Farm Health. I think one of the reasons is we're good at framing the message. And we take information like this really seriously. I'm always thinking around here, how can we make what we do more attractive to a wider base of people? When they're not listening to me, my fault, not theirs. All right, that's it for today. As usual, pass this on to anybody who you think might enjoy watching it. Be back to you on Thursday with more news.